Good afternoon, and thank you for joining us for this community briefing on COVID-19. Joining me once again this afternoon is interpreter Margie Propp. Thank you, as always, Margie, for providing your services to our community. To keep one another safe and to access information and resources available to support our community throughout this pandemic, we encourage everyone to visit our website at covid19.lincoln.ne.gov. There you will find a dashboard with the latest COVID-19 data, and we update that dashboard at about 3 p.m. daily. At our website, you will also find our COVID-19 risk dial, a color-coded tool that gives our residents an indication of the risk level for transmission of the novel coronavirus in Lincoln and Lancaster County. We updated the dial on Friday, and we announced then that we remain in the orange section of the dial, indicating a high risk of the virus spreading in our community. We start today's situational update with some sad news. We have lost 2 more members of our community to COVID-19, a man in his 70s and a woman in her 80s. Both had been hospitalized. That brings the total number of deaths from the virus in our community to 19. On behalf of the City of Lincoln, I extend our deepest condolences to their family and friends, and to all those who have lost loved ones during this pandemic. Today in Lincoln and Lancaster County, an additional 24 individuals have tested positive for COVID-19. The total number of lab-confirmed cases now stand at 3,361. Our total recoveries identified to date are up from 1,436 to 1,459. Here to provide a more detailed update is Health Director Pat Lopez.
Thank you, Mayor. This pandemic has been challenging for all of us as individuals, as families, and as a community. At the Health Department, staff continue to work tirelessly with community partners to manage the virus, to minimize its impact locally, and to do what is best for the health and safety of our residents. And with the help of our community, we are seeing results. Since the implementation of the directed health measure that included the face covering mandate on July 20th, we have seen the number of weekly cases drop. We went from a high of 360 new cases in the week ending July 25th down to 207 the week ending August 8th. That's a 43% decline in weekly cases. We are also seeing a decline in the average number of cases per day. For the week ending August 1st, the average daily number of cases was 45. That was down to 30 for the week that ended on August 8th. The weekly positivity rate has also dropped from a high of 8.3% the week ending July 25th to down to 6% the week ending August 8th. These positive trends occurred while testing remains at a weekly average of over 4,000 tests. With many of our key indicators leveling off or showing improvement, we have been asked why our COVID-19 risk dial is remaining in the orange, indicating a high risk of the virus spreading. Again, we use 3 weeks of data, not just one. Bottom line is that we are seeing fewer infections. This does suggest that the directed health measure and increased use of face coverings has contributed to the decline. All along, we have been working with the community to implement measures to keep things open while protecting the health of our community, and that has not changed. We need to collectively refocus attention on the big picture, working together to minimize the impact of the virus in our community. We should all be wearing masks around others, staying at least 6 feet from others, and washing our hands often. If we can all continue to practice these simple preventative actions, we will continue to find ways to do more activities safely. With schools and universities beginning classes soon, our individual actions will be even more important. We do not want to take a step back and head toward the red area on the risk dial. Let's work together to prevent clusters and new outbreaks and to keep moving forward.
Thank you, Director Lopez. As Director Lopez indicated, we have seen great progress in reducing the spread of the virus in recent weeks. This is good news and gives us hope, something we all need these days, that we can continue to make progress if we respect the virus and take necessary precautions. While there is so much evidence of our community's strength in the face of this pandemic, it's important to recognize that progress in a pandemic is fragile. In our efforts to live with this virus, while scientists furiously work to develop a vaccine, which may or may not materialize, we stand at a crossroads in Lincoln. We have come to a point where big changes are about to happen in our community. While residents have masked up and our case count has begun trending in the right direction, there are three things that we have never done during this pandemic: open our K-12 schools, populate our college campuses with students from other communities, or host more than 10,000 spectators at organized sports like Husker football. Choices on how to move forward are being scrutinized by both the community and our medical experts, and we must continue to have candid and courageous conversations about what is best for our community, our children, and those most at risk in this pandemic. In the months ahead, our health team is committed to continuing to advise community members and organizations about the best practices to ensure safety for everyone in Lincoln. Sometimes this will require difficult conversations and unpopular decisions. As part of our mission to keep our community safe and healthy, we will continue to confront the difficulties and rise to the challenges, just as we have throughout our response to COVID-19. As the data Director Lopez shared with you demonstrates, we are stronger and more successful when our community members join forces with us to defeat the virus. You all haven't just put on your masks, you've put on your superhero capes and helped us make this community safer. Please continue your heroic efforts. We all must be vigilant in our use of the tools that we have to mitigate the spread of COVID-19. Together, we have had many successes in adjusting to the now normal in Lincoln, like celebrating high school graduations at Pinnacle Bank Arena, hosting the first outdoor concert at Pinewood Bowl, and hosting the Cornhusker State Games. Let's continue to make forward progress by wearing our masks, washing our hands, and watching our distance, keeping 6 feet from others. Let's do this to push our numbers down even further and bring the infection rate even lower, knowing that our schools, our economy, and our future depend upon it. We have come this far. Let's keep making progress together. Finally, today is another Sunshine Tuesday. The children in our community are doing a great job of creating and sharing their art with older residents who are homebound during the pandemic. And this is part of our Sunshine Kids for Seniors project. And children of all ages are invited to write a note or create a colorful piece of uplifting art. And if they email those to us at Aging Partners email address, sunshinekids@lincoln.ne.gov, we'll share them with those seniors. The art will be downloaded, printed in color, and distributed to those seniors along with home-delivered meals through housing programs and through other outlets. This Aging Partners program is helping children connect with our seniors, and thousands of pieces of art have been distributed. And if your family would like to participate, you may send your scanned notes once again to sunshinekids@lincoln.ne.gov. With that, we'd be happy to open it up for questions.
Mayor, this is Bill with 1011. I was curious to get your thoughts on the postponing of Husker athletics this fall, obviously something that will have quite the ripple effect throughout the community.
Yeah, that's tough. We've been working closely with our institutions of higher education, both to keep their campuses safe and to try to facilitate the things that we all love that go along with college and university life, like athletics. We've been working for months to try to get Husker volleyball into the Pinnacle Bank Arena so that they can continue their season. And of course, so many are looking forward to what Husker football could be this fall. Either way, I'm confident that whether sports are delayed until the spring or if the university does find a way to do them this fall, the city of Lincoln will continue to find ways, innovative ways, to support their efforts and all of those in our community who benefit economically when sports are being played.
Had the city or county health department given their blessing to the university to attempt to play sports this fall?
I can let Director Lopez answer that question, but, our role really is a supportive one. It's to provide all of the advice about the administrative controls, the engineering controls, the preventative measures that can keep people safe should the universities and colleges go forward with the activities that they plan to entertain. And so that is very much a partnership and a supportive relationship. I don't think Director Lopez has anything else to add.
A follow-up, Riley Johnson from the Journal Star. Did the health department one way or another inform Nebraska Athletics whether they could host football with crowd in attendance of several thousand or above? I mean, was a decision, was that made, yes or no?
I'm going to let Director Lopez come up and answer that question for you, Riley.
Riley, could you repeat that again?
Yes. Did your staff make any sort of recommendation on whether the university athletic department could host games with fans in attendance of several thousand?
No, as the mayor said, we've been working very closely with the athletic department, actually probably since May, on different scenarios that could happen with the different sports that are provided there. I think we need to remember that the university gets its first guidance from the university, and then as I understand it, not being the total expert at football, they get that from their Big Ten conference. And so we've been anxiously awaiting to see what was really going to happen and then what would that impact be.
Other questions from the media?
Mayor Riley with the Journal Star again. First, do you have any comment on the compliance now at Madson's and whether you're confident they'll be able to protect their business staff and customers?
Well, that protecting their business staff and customers is precisely what it's always been about, Riley. And as I understand it, they have submitted a plan that complies with the health department's directed health measures. So we're confident about what the future holds.
This is Brent with Channel. I kind of follow up for that for Director Lopez.
Sure, Brent.
Can you talk about what was in the compliance plan? I think it was last Friday you had mentioned some suggestions the health department had made, including social distancing, mask wearing. Can you tell us what was included in the plan for Madson's that your department felt they could approve?
I can share some of it, but I don't have it all memorized. But there were a lot of things related to the physical distancing and remaining seated in groups of 8, talking about how pool can be played safely, how bowling can occur with every other lane. Those were a few of the things, and that the patrons and the servers needed to wear face coverings or masks. So those were primarily, those are the basic components of the plan.
And they submitted that plan to you, to the health department?
Yes.
Had they submitted prior plans that were denied?
No.
Okay.
And we provided them with templates or examples of plans that were for similar environments similar to theirs. So we very much tried to provide some support and guidance to them in the process. And we need to remember that this is all about protecting the health and safety of the workers and the patrons coming in and prevent the spread of the disease.
If they had submitted a plan that included all those other things you mentioned, aside from requiring masks, would it have been approved?
We, when we gave the order of closure, we asked that they submit a plan that operationalized the directed health measures. And that means all of the components of the directed health measures, and masks are a component of that.
And will the
Director
health
Lopez.
department be following up? Sorry, last one. Will the health department be following up, or have you already, to
We'll
check on
con-
compliance?
We'll continue to monitor Matson's just like we do every business that's open. And we expect that as we've gone through this process, that they're going to continue to comply with the plan that they put forth.
Director Lopez, Riley at the Journal Star with a DHM related question. Have your staff fielded complaints about businesses outside of Lincoln violating the DHM, and have any enforcement actions been explored in those cases?
We haven't had any complaints about businesses outside of Lincoln that I'm aware of, Riley.
Mayor,
Director Lopez, this is Bill. Is it still just the 4 that closure orders have been issued for?
Yes.
Mayor, this is Andrew Ozaki from Channel 7 News out of Omaha. I had a question about the county attorney submitted a letter to the county board today, I guess saying that since Pat hasn't officially been approved by the city council or the county board, that she should be removed as the health director. I guess, do you have any comment on that at all?
Sure. I saw that letter, and it was disappointing. County attorney is a member of our incident command. Pat Lopez is the head of our incident command. We've all been working together closely. Pat Lopez's authority has not been challenged until this mask mandate went into effect. The numbers speak for themselves. I think it's just further confirmation of her authority and expertise about what keeps our community safe. She has my full confidence. And our city attorney, of course, has a differing opinion than the county attorney. But regardless, if making this go away, if we can put this distraction to rest, we will go ahead and move forward through a confirmation process. We have the support of the city council and the county board and the Board of Health for Pat Lopez. We've had it all along. We're lucky she's here with us, and I'm proud to serve alongside her.
I guess, why wasn't this done before? And will it have any type of legal impact on how valid the orders that you have put in place already? As far as any more challenges to the health directives?
Andrew, thanks for asking. Maybe, being in Omaha, you aren't as familiar with the history, but we said goodbye. We lost our previous health director to cancer. It was a very sad time for everyone in our community, and especially our team at the health department. And in looking to find a leader for the department, we asked Pat Lopez to serve. She has decades of history with the department and has worked to provide other health departments with consulting expertise and help them secure accreditation just across our state. She stepped into the role and agreed to serve temporarily until we could find a new health director. And we did undertake a search, but that search didn't yield a candidate that was a good fit for the department. And so when that search came to a close, I sat down with Pat and asked her to stay until we could, find another health director. And she had a few conditions. She wanted to have more part-time hours. She wanted to continue her consulting business, and she wanted a week off in March to take her grandson to Disneyland. And as you can see, all of those conditions have been cast aside selflessly as she stepped up to serve in a pandemic. That Disneyland trip got canceled. Those extra time with her grandchildren, it's in the rearview mirror. She has done nothing but serve this community night and day. We've had to grab her phone from her on occasion and turn it off and let her staff handle the numerous requests for support that come in. And I know that she has the gratitude and support of system leaders throughout our community, whether they're in the medical field or in higher ed. Of course, during the pandemic, searching for a health director is a little difficult for a permanent health director. We will confirm her as a permanent health director to satisfy whatever people need. But honestly, that is what she has been all along. She has been serving us ably.
This is Brent.
As a
No, go
follow-up,
ahead.
Mayor, sorry, Brent. Do you think this is a political move by the county attorney to challenge her authority? You seem to allude to the mask mandate. Could you address that?
I can't speak to his motivations. I can just tell you more about my reaction, which was when I first found out about it. I had to kind of laugh because her authority is unquestioned in my mind. I just opened up my Spotify and, 'cause what came to mind was MC Hammer's Too Legit to Quit. And that's a song I've been listening to today while we've had these discussions.
Mayor, about how long will that confirmation process take?
I don't expect it will take long at all.
Is that something that only needs to go up one time before each board or council, or is there multiple votes and hearings needed?
We'll go ahead and have the city council and the county board and the board of health all vote, but because we are under an emergency order, we can facilitate that rapidly.
Mayor Andrew from Channel 7 again. In the meantime, does that affect if she can order any more closure orders?
No. Look, everyone's been recognizing her authority throughout this process. The state, Dr. Antone, we've implemented directed health measures, but we will go ahead and make this official and acknowledge that all of her previous decisions are official as well, if that's what it takes to satisfy this concern. Because you know what? We need to stop talking about this and keep focused on fighting this virus. We are in a high risk situation in our community. Our numbers are going down, but like I said, we're at a crossroads. We're about to have thousands of people come to our community to start college. We're about to see 42,000 students re-enter LPS in either remotely or in person. We can't afford to take our eye off the prize, which is washing our hands, wearing our masks, and watching our distance. We have got to continue our progress forward. There are no guarantees in a pandemic that your progress is linear. It doesn't work like that. It's not clockwork. You have to stay vigilant and follow the health measures that keep us safe. And that is my focus, and that is Pat Lopez's focus.
Mayor, I have an economic question. With the news about football being canceled and potential for more developments with other athletics seasons, how concerned are you for Lincoln's economy and the businesses that are built around fall Saturdays?
We're all concerned, Riley. There's so much uncertainty, and we do have so much that we depend upon sports to provide for our local economy, whether that's our private sector, bars and restaurants, the retail that people frequent when they're here buying their Husker gear, or the West Haymarket JPA that depends on occupation taxes. It's all very connected to the success of our local economy. So yes, we're concerned. But ultimately, if we cannot get our infection rates down even further, if we cannot prevail over this virus, none of it matters. We can't disaggregate the status of our economy from the status of our public health. They are intertwined. So again, if you want to not only stay safe, but also improve our economic prospects as individuals and as a community, please wash your hands, wear a mask, keep 6 feet distance from others. That is our way forward. That is how we make progress forward during a pandemic. Any other questions?
I have a follow-up question from Mark Vale at KLIN. Condon advised in 2019 that the director should be approved by the governing bodies. Why wasn't that done?
I can't, can you specify exactly when in 2019?
I'll see if he replies. Doesn't indicate, it was a text message. So.
Okay. Well, I know that in the letter that the county attorney sent, he referenced March of 2019. I wasn't in office at that time, so I can't speak to it. In fact, Shabana Loster was still the health director at that time, so it doesn't seem like a very relevant piece of information. Any other questions? All right. Well, we appreciate you tuning in. We appreciate all your efforts to help us keep our community safe. We're so proud of the progress that we're making, and we have you to thank. Please join us again on Friday at 3:30 for our next briefing on COVID-19.